Good afternoon, everybody. Um, Thank you very much for joining us this just barely afternoon. This is our workshop on social care reform, part of Unity Insight's fourth workshop in a series of workshops in response to the Labour Manifesto and the recent election. So kind of looking at the challenges that they've laid out and the challenges facing the NHS and wider health and social care sectors. And really looking to share some of our insights and learnings from various projects we've done in the past that relate to these challenges, hopefully in the spirit of supporting the right developments and sharing the right learnings to progressively work towards those aims. Just before we get going, that's going to cover a couple of brief housekeeping points. First of all, as you've probably realized when you joined the call, we are recording this session with the aim of uploading it online in the end. As I think everyone's cameras are turned off and microphones muted, but if you've got any questions later on, it might be just something to bear in mind. And on that subject, we are using the Q&A function on Teams. So as we work through the different case studies and proceed, please raise any questions that you have. Both Alex and myself will be keeping an eye on it as we go. And if you have the opportunity, we'll answer things then and there. But we also have an opportunity at the end of the presentation to take any further questions as well. So with that covered, I'll proceed into some introductions. So just for myself, my name is Pete Aldridge. I'm senior analyst here at Unity Insights. I joined when we were still part of Health Innovation Kent, Surrey, Sussex back in 2018 and been through the transition beyond that point. I've got a financial services background, but during my time here, I've had experience across a whole range of mixed methods evaluations in a number of clinical areas, in particular stroke services, mental health services, and also social care, as well as some system transformation work such as pathway mapping and use of system dynamics to support our evaluations. I'm going to hand over to Alex to cover the rest of the introductions and yeah, push on from there.
Great, thank you, Pete. So yeah, just to kind of tag on to that I'm a senior analyst at Unity Insights. So I've been here for 5 years. So also part of the previous company being KSS AHSN, moving into Unity Insights and now the Health Innovation Network. So my background's in economics and international business, and I've delivered evaluations covering palliative care, domiciliary care, which is what we'll be touching on today, digital transformation and sustainability. Great, thanks, Pete. So just a little bit on the agenda today. Obviously, Pete's done a bit of an overview there. So we're going to start off by just understanding some of the key challenges and ambitions. So you might be aware of some of the key challenges. A lot of it is not suddenly surfacing. So we'll cover those, understand from the Labour's manifesto, what are some of the ambitions that they're hoping to tackle, before digging into how some of the case studies that we've worked on tailor into some of the value that can be provided. So we'll be touching on the personalized care aspect, supporting the workforce, and cross-sector collaboration. And then as a kind of wrap up at the end, we'll be summarizing some of the key takeaways there. And then we'll be going into that Q&A session opportunity as mentioned. Thanks, Pete. So we kickstart straight away with what are some of the challenges. So we've highlighted a few of the different areas and some of the key stats that we've pulled out or key messages relating to them. So a lot of this, is well known at this point, is well documented and evidenced. So I think some of the key points to touch on are, the element of the workforce shortages and connection to staff retention. So how can, we support these people, because there's some quite alarming stats about the proportion there. You've got 28.3% leaving their social care role in 22/23. I mean, that is a huge amount. So how can we support the sector by improving standards, improving, working conditions for those workers to hopefully support retention which can then lead on to other challenges in there about shortages and the increasing demand through aging population, whilst also looking at other areas such as inconsistent standards and making sure that quality is kept to a high level. And then obviously the key one on lack of funding as well, which is always a hot topic when it comes to new government. Great, thanks, Pete. So kind of linking that more in with Labour's manifesto, we pulled out 6 points here. So you've got that establishment of standards. So this is looking at ensuring that providers are behaving responsibly and that the quality of care is being kept to a high standard across the board. And then a change in approach with the care in the home is kind of similar to that preventative buzzword that gets used a lot in the NHS in terms of keeping people at home for as long as possible and supporting them there. And then we've touched on those points around supporting the workforce and the recruitment and retention in terms of where does the funding need to go? How can we improve workforce conditions to support those challenges? Looking at partnership working. So this is also between kind of like hospital discharge to social care. How can we connect those parties up so that it's seamless, whilst also taking a co-design approach, bringing in all the stakeholders when we talk about this social care reform that's within the manifesto. And this is kind of underpinned by the ambition for the National Care Service. Obviously, there'll be more details to come out, and noting that it wasn't touched on within the most recent budget, but how do we underpin this with the establishment of those standards? Thank you, Pete. And do you want to add anything in there?
Yeah, I think you just touched on it really. I think that one of the key points there is that things are still changing and emerging over time, as everyone is aware. But a lot of the issues underlying the changes that have been outlined are long-standing ones, as Alex has said. But some of the things are still changing more in terms of the pressures on different organisations, such as the national insurance contribution reforms in the latest budget. Things like this, it's a constantly changing piece, but we've mainly been devising this on the basis of the manifesto and, where relevant, Lord Darcy's report as well, which was released a few months ago. So yeah, I'll proceed into our first case study in that case, which is looking at the care in the home perspective. So home first and the provision of personalised care. We thought it was a good place to start because obviously it's best to keep the people actually receiving the care at the centre of our thoughts along the way. And this relates to a project that we undertook quite recently, well, a year or so ago. So within this area, the challenge is to develop services that can produce consistent outcomes and are also sustainable over time. And the home first principle obviously underpinning everything. There's three key words coming out in the manifesto of independence, dignity, and respect, which I think is the ambition of quality of care, along with safety, most importantly, across the whole sector. So the government intends to develop the infrastructure and provide those standards over time to deliver a consistent high quality of care in the sector. However, lots of commissioning parties and different providers have already been working in this direction, and are already looking for the right approach, something that can be scaled effectively and supporting the financial and logistical challenges in the sector, particularly those faced by the varying budget holders involved, and taking into account all the different perspectives. So before I whiz my way through too quickly, I'm going to quickly cover what this project was all about. So working with a range of different partners on this one, it was quite a large project. We were working primarily with NRS Healthcare to evaluate a test and build pilot of a tech-enabled care service. So the use of digital tools to support care provision. It was a mixed methods evaluation, so used qualitative and quantitative elements, including an economic evaluation, taking the council's perspective primarily into account for that. So looking at the impact on the people receiving care, but then also the knock-on impacts in terms of care placements and whether there are any further benefits elsewhere within the system. The reason behind the change itself was the council's core strategies already emphasized the ambition to move to a person-centered care model, improving quality of care delivered under the Care Act, and also looking to enhance the support that individuals receive after an admission to hospital or a similar healthcare episode, just to help continuity and also return to um, life at home wherever possible, for as long as possible. It was a 12-month pilot service to March 2023, so a little bit longer ago than I thought. And as I say, working with the likes of the Digital Innovation Centre, who helped underpin a lot of the training involved in the project, and EK360, who worked with us on the evaluation, providing additional qualitative data collection and analysis in terms of holding direct interviews with a lot of the stakeholders along the way. It was a very interesting project in terms of developing quite an ambitious and high level, like well presented offering from NRS. The pilot program provided through essentially a digital storefront a wide range of digital tools and technologies that were made available for a prescribing team to then meet with the individuals receiving care, build out a care plan, and identify the right tools that could support them to achieve their objectives. So those range from just simple monitoring and communication systems. So it could be accessible mobile phones that would help people still move around with having the right alerting and monitoring systems that they may need due to where they are in their care requirements, or devices specifically looking at either rehabilitation or help combat certain conditions, dementia being one of the more common ones in some of the devices available in that area. Along the way, the process was found to require quite a lot of expertise and input from the occupational therapy and the expert prescribing members of their team, the people basically who had the knowledge of the technology involved and could help devise the individualized care plans, while the wider registered practitioner teams could be upskilled and understand that and access the storefront and effectively prescribe the right tech as well. Playing up. So, as mentioned, along the way, there were a few challenges in terms of delivery. One of the key ones was developing that skill set. So that did have some delaying effects on the launch, making sure that everyone had the right training and felt comfortable with the tools, the storefront, and everything else, utilizing the right support from NRS along the way as well. And there were also another logistical element that needs to be considered with some of these changes, quite often is around the supply chains. This was still a post-pandemic world, and there were still shortages of microchips and various other components around the world, and that was still having an impact in some respect that did affect the scaling of the project because certain devices weren't available to meet the demand that was coming from the community. For our part, one of the key things that we looked at around this was trying to make sure that we keep the person receiving care and support at the center of our thinking. And to do that, we worked on a pre and post surveying process, capturing and letting the people themselves and their carers identify the key care priorities for the individuals receiving care. And those were drawing on a list of 15. They're called activities of daily living. There's a pre-established framework. The three most important ones that were identified: independence, safety, and maintaining an active social life. So along the way, as the charts on the right indicate pretty clearly in terms of distribution of responses, before the introduction of the technology-enabled care, there was high levels of dissatisfaction being reported, and that was not completely, but a long way towards being reversed through following the introduction at the 2-month review point. That was particularly in the case of the priority areas recognized. So, I mean, independence was one of the most highest rated, ranging from one side to the other, where you have people leaving care homes and all of a sudden back in their own home and able to autonomously live their life, and the impact that that has. And that was also reflected in the findings of EK360, who found that there was a significant increase in quality of life along the way as well, from their more in-depth follow-ups and things like that with a particular sample. I think they contacted 30 participants directly in that process. So the measurement and the evaluation really clearly showing the impact and the benefits of putting the person at the center of the care delivery, essentially. Across the broader perspectives around the project, as I said, this helped generate evidence that the person-centered approach to care did lead to a positive impact on quality of life. However, the other perspectives within the evaluation did show that it was acceptable and recommended by staff once that initial hurdle of initiating the cultural change and getting the right training and skills development in place. Once that was overcome, people were very happy with the offering. It was, from the council's perspective, it was found to be a bit of a short-term investment, so an initial loss in the first year, following but leading to a longer-term economic gain after that initial cost had been undertaken. So the training, essentially, and the enhanced support that was required at first. But over a 5-year period, it was projected to have a positive return. So that delivering efficiency for the council services and also helping people stay in the home for longer, live more independent lives, and be less likely to rely on admission to care homes or additional enhanced support offerings along the way. We did also identify a range of further benefits to the healthcare system along the way, and the wider care sector, relieving pressure on beds, care home placements, and things like that. As I've mentioned, part of the discharge processes there. Unfortunately, the data wasn't available across partnerships to fully realize those. Plus, it was suspected that in the time frame of the change, even a year was probably not quite enough to see that, as it was going to be the people out of hospital receiving the technology, and then it was going to be the impact of how often those people may be admitted to hospital further down the line, where that benefit would really be shown. So it was going to be a multi-year thing, and something that's scope for further evaluation rather than shown within this one. So yeah, the whole piece was a quite successful project in terms of working with a large range of partners to help show the impact that it could be had for the people receiving care and support. And also the use of varying approaches for evaluation to help capture that, especially showing the various perspectives involved in the project. I'll pass back to Alex for our next case study.
Great, thank you, Pete. That was really useful, and it's always great to be able to see so clearly on that graph such a dramatic change over just like an 8-week period. It's quite remarkable. So now I'm going to be touching on kind of focusing on supporting the workforce, but also there's other elements within that, and a case study that I worked on. So next slide, please, Pete. So we'll do a little bit of scene setting again for this one. So this is looking particularly in the domiciliary care space. And a bit of the key context here is it's a highly intricate system, and you've got a huge array of different providers with differing standards and processes and working across their local authority requirements. And obviously, as demonstrated earlier, you've got this massive workforce there, which has increasing demand, and the workforce challenges highlighted. And you're trying to ensure that the right caregiver is available at the right time and place. So that's talking about kind of the care worker schedules that are put in place to support people. As this is complex, it presents challenges for providers in ensuring fair and effective schedules. But obviously, you want to maintain that high quality standard whilst also trying to be efficient. And it is a complicated task for commissioners and decision makers to identify what are the key structural and systemic changes that may be required to improve the system. And then kind of on top of that, because you've got that varying kind of setting for each of these providers, it's hard to, without established standards in place, to have a clear and comprehensive data set. and then you can make more informed decision making, and you have greater visibility of the landscape. Thank you, Pete. So a bit of an overview of the project itself. So we're working with a Finnish company called Procomp on their strategic optimization service to support the social care workforce. So trying to put it in layman's terms, you basically had Procomp directly communicating with providers and council members, and they would have data requests from those providers, and then they would take that data and they would put it through their optimization software, analyzing where's the best efficiencies, where can you optimize their care workarounds, and then they would present these back to those providers through a list of recommendations, and then it'd be up to the providers themselves to see what they felt they could implement from those rounds of recommendations, we would call it, within the project. So areas that we looked at in particular were the carer workloads, the scheduling process, and the allocation of care packages. As mentioned, Procomp engaged with those providers to create a list of recommendations to generate optimizations. This piece was approached as a kind of an early testing phase with the pilot to understand the potential opportunity and barriers in place. And we did this across, Procomp engaged with 2 social care providers and the relevant local authorities. And we worked alongside the Health Innovation West of England. And this was across last year, so 2023/24. Thanks, Pete. So the method that was taken was a mixed methods approach. So we wanted to capture a range of perspectives. So you have the quantitative data, which primarily revolved around a data set containing the care worker schedules and estimates for travel distances and timings. We didn't dig into the detail of the kind of case mix required for each of those, but that's kind of very kind of particular data set there. And then we looked at the qualitative insights. So we had surveys with the care workers before and after rounds of optimization to see what they felt the changes, had they seen, were any changes visibly felt from them. And we also had interviews with provider leads and local authorities to discuss kind of other aspects such as the communication and benefits of the innovation. And separately to that, we had the health economic modeling. So basically bringing that data set together from the quantitative, formulating our expected cost and benefit streams of the program. So, the cost of implementing this, the project engagement, the time taken to provide the data to Procomp, and then looking at the potential benefit in terms of travel distances being down. Can they provide more care packages and other areas such as the environmental side as well? So trying to understand that value-based perspective as well. So in terms of the key kind of topic areas, we looked at acceptability, the effectiveness, and also that kind of value-based side of the innovation. And these were collated into a final report and summary infographic for dissemination as well. Next slide, please, Pete. Great. So in terms of some of the results from there, so you got quite a range of perspectives, so I'll touch on a few of those. So from the care workers themselves, there was a strong positive reception. So we similarly to what Pete showed in his graphs in terms of some of those different workforce conditions, there was really a positive improvement noticed for workload, feeling supported, the scheduling process, and also pay and remuneration. And although, and we'll touch on this a bit later, it wasn't visible within the pilot data itself, you would expect those kind of improvements to lead to improved retention rates in the longer term. Obviously, with the timeline of this evaluation, we didn't see that within our data set. From the domiciliary care provider perspective, they saw impact in terms of travel distances and number of visits directly after recommendations were implemented. So a benefit there from an efficiency perspective, but over time, we noted that that impact seemed to be diluted. And then the providers, the leads, especially, and potential efficiency gains, communication with the local authorities in particular, but noting some of the barriers in place, such as recommendations not always being nuanced enough. And part of this comes down to the data availability as well, and some resistance to change, and that the actual engagement with the project, so the requirements to collate, clean and provide data to Procom, and the project meetings required, all those factors were quite high. When there's always a demand on your time in those sectors. And then just noting from the local authority perspective that they also aligned with the care providers in terms of the improved communication and the potential efficiency gains that they felt they could see. And there's a bit of a demonstration on terms of the impact in that graphic there with site A and site B on the right side. So reduction in miles traveled by care workers the first month after implementing a round of changes. So 7.8% reduction in one site and a 4% reduction in the other site. And I think the key message was that overall, the evaluation demonstrated an opportunity was here for providers and councils to deliver a better experience. And some of those knock-on impacts would be to the service users in terms of that point regarding access, where if you're more efficient and you can complete more rounds without impacting quality of care, then you can improve the time to provide access. And then obviously the key one there on care workers and retention rate, if you're improving work conditions, you'd hope to see a benefit there as well. And this can all support tackling waiting lists, and also the environmental side with the net zero plans of reduction in mileage, because you're providing a more efficient route system. Great, thanks, Pete. Next slide, please. Some of the key learnings from this. So we're aware of the data challenges, and it kind of highlights that value in establishing standards, which we would expect to extend to data collection, because then you can really support decision makers through an evaluation. So those inconsistencies between our two providers, and so trying to paint an image of the potential impact when you've got variation there, it makes it a bit harder. And then kind of understanding what were those barriers in change management and how can we overcome those. And it's interesting to see kind of our approach to evaluation, often with that co-design approach of bringing in stakeholders, having logic model workshops, kind of being noted specifically within the manifesto of how they want to tackle social care reform. So I think it can really support the buy-in when you bring everyone together at the start, rather than just being told what's going to happen and change. I think most of us can relate to that. And then just kind of a note on the dynamic environment of domiciliary care. So we mentioned the variation between providers, but you've also got regional variance, and that impacts client needs. And then also there was legislative change during the evaluation timeline, which obviously makes it harder to paint a clear image of impact. Some of the recommendations that we then pulled through from this links to some of these factors. So in terms of interface access, there was notes around the providers having direct access. So this can help with those points around the time requirements. If they can go straight in there, that might support their kind of eagerness to engage, and from their side, the time requirements to do so, as well as facilitation of more regular changes. We saw that dilution of impact. So if they have access and they can implement changes on a more regular basis, and they feel like they have more control of it from a provider perspective, you might be able to see more routine changes. The greater transparency in terms of reporting, but we've touched on that already a fair amount, and then the client requirements. So just supporting and working with the providers to enhance functionality and flexibility into the optimization software so that they can overcome that mentioning around the nuance in providing care. And then in terms of just the value base of the evaluation, we just wanted to touch on making sure that we celebrate the successes. So, where we have seen changes, making sure that we can share that learning. You've got an independent evaluator who's talking about the impacts, and then, okay, we've identified these barriers, and now how do we share the learning around from the project side, the project implementation, but also the evaluation side around understanding the impact from those areas of acceptability, effectiveness, value even further, to support kind of future spread and adoption, and try and realize some of these opportunities, I think is a key point there. Next slide, please, Pete. So yeah, I think I'm handing back over to you.
Yep. Thanks, Alex. Interesting stuff again. So the third element that we're going to look at is around partnership, working, collaboration. This is a slightly different approach to the other two case studies, and that is slightly more conceptual, but we are drawing on a specific example. So obviously one of the key challenges within the social care sector in particular is developing services that can provide seamless care experiences for the individuals receiving care. The number of parties involved and the number of different perspectives involved complicates this quite a lot from pretty much everybody's perspective. On the right, I've got illustration of a few of these perspectives: the people and their carers, families, and so forth, the staff and workforce delivering care, the private providers who are quite often facilitating that, and then the local authorities and healthcare organisations that also do their fair share of facilitation of the care service itself, but also have the division between public and private sectors, as I mentioned. There's other concerns there in terms of how much can be held within the public services, but also what can be done to make sure that private service is a viable and scalable option as well. So evaluation and measurement really fitting in terms of accounting for that wide range of perspectives and putting together projects and programs that can help measure that and support complex pathway developments over time, which is something which, if something as complicated and large as a national care service were to emerge, is something that we would have to all support and work towards and help progress towards that aim, and be obviously a significant challenge. In the post-pandemic world, one of the projects that we were involved in was providing a review of the discharge to assess pathway. So this is an example of quite complex, lots of different stakeholders, a national scale project. It already kind of existed, but it was expanded greatly through the pandemic, obviously to support earlier discharge following episodes of care, and ultimately to release beds and pressure from acute hospitals. The aim of the pathway was to reduce the length of stay, as mentioned, for people medically fit for discharge. So facilitating that move to care in a community hospital or another setting, care placements, or sending the patient home eventually. Moving the point of the assessment for ongoing care away from the hospital into the community, and allowing the funding to cover a 4 to 6 week period after that, reflecting the main underpinning principle, not undermining principle, that's discharge is a process. It's not a single event. It is something that requires coordination and cooperation across multiple different parties to ensure that the patient or the individual receiving care is receiving the right care at the right time, in the right place, in the most appropriate place. And engaging with social care and staff at local level as well along the way. So this project built on quite a bit of our expertise in that for over 5 years now we've supported the health innovation networks across the country, developing national metrics and impact measurements in general, and helping coordinate that service as well, so they can do their own impact reporting on a national scale. So we were drawing on a lot of that knowledge to help, and then also working with University of Kent, who'd done their own evaluation work as well in this area, to devise a measurement strategy to look at this and help build a robust impact analysis ultimately for the deployment of similar large-scale pathway developments, specifically and obviously discharge to assess, but something the principles of which could be taken further than that as well. Some of the key recommendations from this process kind of step up through various levels within the sector, starting at patient level and developing national standardized post-discharge outcome surveys for both patients and carers to correctly capture their experience and the benefits at an individual level. But then using those findings to help support local quality improvement, and also demonstrating the impact of the pathway across regions and across different cohorts of the population. Then from an organizational perspective, it was about understanding the impact for each organization and also developing measurement plans that support them and help generate evidence for their own evaluations tailored to their local aims and priorities. Capturing consistently management information across the whole pathway, tracking the implementation of the pathway, but also keeping track of the broader patient flow. So which patients are at which stage, in which type of service, what type of care are they receiving, and being able to see that picture of what the shape of the service actually is in terms of which patients and which individuals require what level of support, I suppose. Then at system level, providing the resources and developing dashboards and similar reporting processes that can then report back into the local systems as well. So you're seeing the impact at a national scale, but also sub-ICB level, to help provide system and place-based leadership, essentially enabling evidence-based decision-making, and providing that information for quality improvement activities, local level, but also sharing learning, celebrating success, as Alex puts it, and also ensuring that best practice is carried out and followed nationally across the whole piece. So unfortunately, I mean, fairly predictably, I guess, following the pandemic, with number of financial constraints that the country was facing, funding was withdrawn from the programme in 2022, which did lead to many areas returning to pre-pandemic processes or alternative processes that they could fund locally. However, facing obviously post-pandemic levels of demand. But the pathway does still provide a very strong example of that need for developing the infrastructure and frameworks that can support strong collaboration for pathway development, making sure that the need for that clear cross-sectoral data is there and it was addressed, and that will then support further developments along the way through a greater understanding of the population and how the services interact. And also the benefits of developing measurement strategies such as these and providing an avenue for sharing learning that provides meaningful insights across the whole sector. And it's going to be an essential part of meeting developments that if we're going to meet Labour's ambitions, if those are going to come to fruition. And these can include making economic cases, measuring benefits that can be quantified and turned into cash releasing, well, measured as cash releasing or non-cash releasing benefits along the way, understanding where the investment in the system needs to be made, but also where the benefits are likely to be realized. And then building that across the whole sector and understanding it across the whole system in order to build an infrastructure that can be sustained through funding and also the buy-in and support from the various stakeholders involved in delivery. One of the key approaches that I wanted to draw out within this is making sure that things such as cost utility and social return on investment, which are both approaches looking at the impacts on the people receiving care, but also the wider social benefits as well, are still an essential part of that, making sure that that perspective is not lost in amongst various budget holders trying to show their perspectives as well. And that's where independence is a key part of that process as well, and looking at it from a 360 kind of view of everyone involved in it, going back to my first slide in this case study. Yes, so as we've only got 5 minutes, it's fairly good timing to go on to a quick review of the summary points. I see we've also got a post in the Q&A as well. So across the 3 case studies, just to reiterate some of the key points across that, we've looked at person-centered care, the need to develop services that meet the needs of individuals receiving care, the culture change and service design adaptations that might be required to facilitate that, and also the use of digital tools that can help produce scalable models of care that could be efficient and also improve quality. However, the application and prescribing of those is a key consideration. There is still a need for further development on data, which is, I'm sure, everyone's favorite subject. But hopefully this is where the development of clear standards is going to really help unlock this. It could enable effective collaboration, higher quality of care, again, across public and private sectors. And yeah, that will unlock the ability to measure more of these benefits from the healthcare perspectives within NRS healthcare through to some of the ones related to ProComp as well. It will help develop those pictures and see a fuller picture of the benefit the different changes will make. Finally, the key point around supporting the workforce, reducing the burden, supporting efficient time management, building sustainable models of care, developing skills and investing, helping staff build careers to help retain the expertise within the workforce that already exists. And a few final comments just in terms of our perspective within this. Obviously, we're an evaluation analytics company and often see that the process of evaluation is something which is sometimes undertaken a bit as an afterthought. However, thinking through and having the right approach, designing evaluations that address the change that is the impact that is intended by a change is key. So understanding the impact of developments is key, and we do a lot of work around logic modeling and things like that help draw out the real connections between here's the change we're going to introduce and here's the impact we want to have, and then you devise the metrics and the measurement plans around that. Creating avenues to celebrate success, sharing learning, however we want to put that, it's key, not just to buy in, but just for making things sustainable and keeping things moving over time. Demonstrating the value, which is really a matter of that perspectives again, covering off all the various perspectives and stakeholders involved, and appreciating the fact that there are different pressures on different parts of the system that need to be accounted for, which do add a layer of complexity here. And ultimately, obviously, the main aim being supporting evidence-based decision-making that will lead to long-term improvement in the sector. Right, so that is kind of the final statement. So if anyone's got any questions, we've got a few minutes left within this time. Thank you very much for your time again. We did have a post. I haven't seen it. Will the slides be shared? Yes. We will be sharing the slides, sliding the shares. Afterwards, they'll be available on our website, and also the recording of the session will be uploaded as well. This is the 4th, as we mentioned, in a series of workshops, which the next one in a few weeks' time relating to reducing health inequalities, which if anyone is interested, they can visit the company Eventbrite page, which will be also uploaded online, our website, LinkedIn, wherever you found the invite for this one as well, obviously to have the sign-ups for the next session in the series. And as mentioned, I think it'll be uploaded to our YouTube channel as well, this talk. So yeah, thank you very much.